The biggest benefit for our patients when choosing Cerner Retail Pharmacy has been they don't think of us as a separate entity. They think of us as all the same, all part of MU Healthcare, and for them it really is a seamless experience now. Before we switched to Cerner Retail Pharmacy, or CRP, we had very siloed environments. We had 9 different pharmacies operating with 9 different databases. So 9 different drug files, different physician files, different patient demographics. So Cerner Retail Pharmacy allowed us to kind of have that seamless integration to where we weren't taking precious time entering in demographic information for those patients. We've had 0 downtime, where before we would have several business hours a week of downtime, which is not great for patient care at all. So having a reliable system, and it's also been very cost-effective for us to keep within the Cerner family. We chose Cerner Retail Pharmacy for lots of different reasons, primarily because of its integration with the medical record. So on an incoming data feed, being able to have all those patient demographics flow over to us was absolutely key. And then on an outbound feed, being able to push an M page to the physicians, so patients' fill history is displayed to the physician. Leveraging that connection with the medical record is what makes our retail pharmacies different than maybe a big box chain, is we know everything about that patient versus just that information contained on the prescription. It's really important to have all the information together. As a practicing pharmacist and clinician, often all we have is just the information and the prescription. We don't know what it's being used for, we don't know the diagnosis code, we don't know any contextual information about that patient. The medical record has all of that. So having that within one click is huge for our clinicians, as well as for our pharmacists and folks dispensing those medications, to look for drug interactions, to look for indications, appropriateness of therapy. We've been able to see some positive metrics with regards to our capture rate. Not everybody fills their prescriptions, but the ones that do leave with prescription are predominantly choosing the Mizzou pharmacies. And we're able to track that because we can see the e-prescribing data. It's kind of a win-win for everybody because it's coordination of care, but it also maintains the revenue in the health system as well. Another big benefit we've found has been standardizing the inventory. Previously, we carried 9 different drug files, so we were able to sell things at 9 different prices. We now share the same drug file, the same pricing, and are able to kind of have a standardized approach to managing the drug inventory levels. And we're also able to share inventory back and forth very easily. Probably the third biggest benefit for us has been the workload balancing. We're able to pull up separate instances of the locations and help each other out. So processing the work through the different queues is able to be done remotely. We've been happy to have a fully integrated both point of sale and software system. So we're able to take credit cards securely as well as process all the prescriptions in one single solution. We're a large source of revenue generation, so it's real dollars. It's not sometimes when you think hospital pharmacy, you think kind of funny money or just reducing costs. On the retail side, it's really about leveraging revenue. So how do you really maximize your capture rate, maximize the amount of prescriptions you can put through your pharmacies to bring and maybe sustain some health systems that maybe don't have retail pharmacy. So having the Cerner solution's really been key for us to just kind of have a one-stop shop for everything.